Let's get ready for parent and child bonding exercise. Before you start the exercise program, please take note if you have been given birth 6 to 8 weeks ago and you have not been active during your pregnancy and after your delivery, I would suggest you consult your doctor and get a medical clearance before you start your physical activity. During the exercise, if you're feeling unwell and you find that the exercise is a little bit too much for you, please stop the exercise and you may make an appointment with the doctor and discuss about your exercise program. Listen to your body, work at your own pace, and make sure you hydrate during the exercise and after the exercise. Let's get ready. Exercise number 1 is called the squat with a tap. So basically, you're going to squat down and transfer your body weight to the side. So this actually works the front thigh muscle, your buttock muscle at the back, and the side of your hip. At the same time, you are also strengthening your hip joint area so that you have better joint stability. So legs apart in a wider position. So probably about slightly wider than your shoulders, and your knee and toe should be pointing in the same direction. When you're holding the baby, make sure the baby feels secure. One hand on top and the other hand at the bottom to secure your child. Ready to go. Sit down and transfer your body weight towards the side. So I'm not lifting my leg off from the floor, but I'm just tapping my feet down on the floor. So alternating the movement, work at your own pace. You don't have to rush for the movement. For those who have been very active before your pregnancy, during your pregnancy, and after your pregnancy, you can add a little movement here. So lift your leg off from the floor so you have more contraction at the side of your hip. You can do it for 8 to 12 repetitions. Exercise number 2, which is actually a kneeling with a torso rotation that works the side of your abdominal muscle we call the oblique muscle. Make sure you have a cushion with you in the kneeling position. You're going to turn your baby around so that your baby will be facing you. Hold on to the baby and make sure your baby can see you. So your legs, your knees should be shoulder width apart. From here, contract your abdominal muscle. Inhale and exhale, press up. And with a slight rotation, come back and release. Inhale, exhale. And come back to your start position. Repeat the exercise. Inhale, exhale, rotate, and make sure you keep your stomach tight. And up. So you work the shoulder muscles. At the same time, you are also working your oblique muscle. If you look at the movement that I have, I don't move my hip at all. It's only my upper body rotation. You don't have a lot of rotation here. It's a very small little angle rotation so that you can work your internal oblique and your external oblique, which is the side of your abdominal muscle, or we're talking about the second layer and the third layer of the abdominal muscle. So again, you're going to do it for about 8 to 12 repetitions. Exercise number 3 is called Kiss Your Baby. So make sure you have your baby on the cushion. So make sure you're not placing your baby completely on the concrete floor. So you can have a cushion underneath as well. So you're going to come down in the 4-point position. And your arms, your hand should be slightly wider than the shoulder. Now first, you need to contract your abdominal muscle. Keep your abdominal muscle really tight. Make sure this eye contact with your baby. Here you go. Go down slowly, kiss your baby, and you push your body weight up. Try that again. Kiss, and exhale when you push up. Take your time to do it. Your baby will be smiling at you, and try to communicate with your baby. When you do that, do remember to keep your abdominal muscle tight. Do it for about 8 to 12 repetitions at your own pace. If you find that 8 reps is too much for you, work for 6 repetitions. Good, we're going into the next one. It's called the Superman exercise. So same thing, you're in all 4 points position. So your wrist, your elbow, and your shoulder form a straight line. What you need to do is contract your abdominal muscle really tight. Extend your right leg to the back. Extend your left hand towards the front. Inhale and exhale, reach. And come back down. Switch hand, switch leg is always in the opposite direction. Inhale and exhale. Squeeze your buttock muscle and come back in. Now the Superman exercise actually works the whole core muscle, your spine, your abdominal, your buttock muscles, as well as your hamstring muscle. While you're doing this, you can actually talk to your baby. So that actually helps in bonding with parents. So do it for about 8 to 12 repetitions at your own pace. Do not rush. The 5th exercise is called the toe tap. Now the toe tap exercise work the deep layer of your abdominal muscle. We call the TA muscle, transverse abdominal muscle. At the same time, it also strengthens your pelvic floor muscle. So lay down on the floor. And your baby will be sitting around your stomach area. Now focus your breathing first. Inhale from your nose and exhale out from your mouth. Inhale now. Now when you exhale, press your lower back down on the floor. So you can feel that you have a pelvic tip. That means you're rolling your tailbone off from the floor but not using your legs to assist you. Let's try that again. Inhale. Exhale, press your lower back down. Maintain the flat abs. Lift up your right leg slightly off the floor. You can feel a very deep contraction at your lower abs and release. Inhale. Exhale, press your lower back down and lift the other legs. Now once you get that, you're going to lift up both heels. Inhale. Exhale, press your lower back down. Lift your toe and tap the other leg and tap. Inhale. Exhale, press down. Lift your toe. Tap it. Inhale. Exhale, press your lower back down. Lift your legs and tap it. While you do the exercise, you can talk to your baby and you can play with your baby. But constantly be aware about your movement. Inhale. Exhale. Inhale. And exhale. Do it for about 8 to 12 repetitions.